Ladies and gentlemen, this is an article that came out on CTV News up in Canada. Opioid crisis may be decreasing life expectancy for Canadians. So, Canadians are pretty much in the same boat as Americans when it comes down to the opioid plague that's going on. So, as you can see, it is so many people dying that it's impacting the life expectancy. And just like America, Canada is lowballing the numbers. There is no way 4,000 deaths impact the entire life expectancy. It would have to take thousands or even millions for that to be impacted. So they are clearly lying, just like the Americans are, on the amount of people that are dying. They're lowballing the numbers. Canada's chief public health officer says the opioid plague is responsible for limiting Canadians' life expectancy. In a report released Tuesday, Dr. Theresa Tam says life expectancy has been steadily on the rise in Canada, but she warns that the life expectancy in British Columbia is decreasing. The province hit hardest by the opioid plague. Tam said in an interview that there has been about 1,000 deaths related to opioids the first quarter of 2018, saying it's on track to see the same numbers as last year, which saw nearly 4,000 Canadians die from apparent opioid overdoses. Tam said the significant number of British Columbia deaths caused by opioid overdoses, particularly among men, is going to have an impact on broader life expectancy rates. Her department is still working on national calculations to get a broader view of the statistics that have been revealed in British Columbia, and added that one might expect to see similar numbers at the national level. She added, every province in Canada has experienced the impacts of the opioid plague. So I think we would expect that dip in life expectancy gains that we see in British Columbia maybe not in the same level of magnitude, said Tam. Tam's report focused on alcohol, cannabis, and opioid use among youth. Also says the drop in life expectancy is prominent among men and Canadians living in poorer neighborhoods. Men in their 20s, 30s, and up to age 49, particularly in British Columbia, are particularly vulnerable, she says. That's pretty much the age range here in the US as well. They usually go maybe a slightly different. In the US, it's 25 to 54. So as you can see, in Canada is from the 20s up to 49 that are heavy, that's having the hardest impact from the opioid abuse. Tam said Canada needs to apply a gender-based approach, in analyzing why men are disproportionately impacted. So it's pretty much mirroring the US because the men are the heaviest impact here too. But, the women are right up there with them. I think we do need different approaches to address the gender-based uniqueness of the impact, said Tam. Tam said in the report that Canadian regulations coming soon that will restrict marketing and advertising of opioids to healthcare practitioners may help reduce over-prescribing of the drug. So they did the same thing with doctors just giving it out like candy up in Canada. But Canada also has the same problem with drug trafficking. And it's going to be the same situation. Whatever they can't get from a doctor, they'll just go out and get the street drug. It won't slow anything down, just like it didn't slow nothing down here. All right. So they're saying that Tam said it's important to ensure cannabis isn't attractive to youth. Well, cannabis is now legal in all of Canada. They legalized it just a few weeks ago. And especially to those who use the drug to cope with stress, tackling every drug issue at the time of a crisis is not where I want to go. We need to go upstream and get to prevention. Well, Canada have safe injection sites up in British Columbia, and you can see where they got safe injection sites, they have the highest death rates. See, that's one thing they're not telling you, and this is exactly what they're trying to do in the US. They're trying to open the safe injection sites where these junkies can take their illegal drugs and do it in front of a nurse or somebody at a facility with a medical license and get high. And they got Narcan available, so if they OD, they can just administer it right then and there on the spot, which I don't see how that's legal. And we'll see what happens. They're still talking about opening the one in Philadelphia, Pennsylvania, and San Francisco. But please tell me what you think of this story about the Canadians. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.